Uh, uh, I was just about to say, don't forget to hit the record button. And um, welcome everyone to the one of our Caris Institute trainings. It's good to see so many names and people that I have fond affection for. Among tops on the list would be our invited guest today, Dr. Isaam Smeir. He and I go back to Northern Illinois University, where he was a doctoral student, and I was just trying to recollect when we first met. Was it around 1999? When did you start at Northern?
Yeah. Around that time, I can't remember. I think that's sounds right.
Dr. Smeir is Jordanian by birth and a dentist in his initial training, and then came to the U.S., received his master's degree from Trinity Evangelical Theological Seminary, studying under Gary Collins, and then came to NIU, where I participated in his doctoral studies. Since that time, he has been in the field of international trauma and worked for many years with World Relief, and particularly attending to their immigration program, bringing refugees into the United States. And since then is a bit of a, for lack of a better phrase, and a consultant to organizations and working internationally, particularly in Arabic-speaking countries around trauma and refugee care. And he lives in the western suburbs of Chicago with his wife and family, and you can detract him by talking anything soccer, and that will spin him into other realms. So with that, let me also say the CE request, if you need CEs, you need to make sure you stay for the whole presentation, and also put a conversation in the chat box so that our grad assistant Caitlin can see that you want CEs and that you are here. So when she goes and makes the certificates, she can distribute them all to everyone who is wanting that. Dr. Ripley, did I miss anything? And Dr. Ord, good to see you. Could you open in prayer and then we'll begin?
Happy to do that. Dear Heavenly Father, we come to you in the name of Lord Jesus. Lord, we just pray that the information that will be shared with us today, Lord, that we would be good recipients and good stewards of this knowledge, and that you would use this knowledge that we're learning today to further your kingdom, Lord, to heal those who are hurting and to advance your kingdom on this earth, Lord. We pray for all those things in Jesus' name, amen.
Dr. Smeir, it's all yours.
Right. Okay, well, first thing, thank you everyone for inviting me. I'm looking forward to this time with everyone. And just in terms of the my presentation, I was thinking that maybe we can do this. I would love for this kind of like a portal to be as much as interactive as possible. So I think maybe what we're trying to do today, my plan is maybe to speak for maybe 40 minutes and then open it up for the last 20 minutes for more kind of conversation back and forth, and maybe questions. I like to hear your input about a few ideas I'm gonna throw out there. And also, but also I think rather than waiting till the end as well, you feel free also to write something on the chat, and I keep my eyes on. This way, maybe we can cover more areas since we have kind of limited time. But anyway, our topic today is, I know I talked to Dr. Sells about the group, and he mentioned something that a lot of you are interested in, pretty much working in marital setting, and we talked about how would that work in terms of working with couples and families who are either immigrated or they come from a different cultural setting, and how the foundation of marital therapy, for example, play either well or not well with certain cultures, and also to add into this also the piece of trauma that as many of those families that you might end up working with, they have, experienced some kind of trauma, whether they were refugees or immigrations, and not necessarily also only trauma. It could be also a lot of, emotional and relational losses of, because of relocating to different countries. So what I'm trying to do is today, we have limited times. I'm just going to throw some ideas at you. And then, I'm not going to be able to answer all the questions for many reasons. One of them, I don't have all the answers, but I think it'll be good to hear from you, your thoughts, and also for some of you to take the conversation further as well. So I'm not a big fan of slides and presentations, but I thought maybe I should share some just because we have limited time. So I don't want to throw you off so many times. So I'm going to see if this works here. Let's see. Yeah, here it is. Okay, so can you see the slides?
Yes.
Okay, so basically we will be in the next 48 minutes jumping into three major topics here. Marriage, which is basically a long-term committed relationship between a husband and wife that has, like any other two individuals who live in very close proximity, they tend to have certain dynamics. Some of them are functional, some of them are dysfunctional. And typically when they come seeking help, there are certain issues or challenges. Could be situational, or it could be also historical. People bring their emotional baggage to any relationship, and they have different sets of sometimes of values or lifestyles and that kind of stuff. So with time, this is, things start to emerge. The other two pieces that I'm going to bring into this is the culture, and I'm going to spend quite a bit of time there. And the third component is the trauma, which is I mentioned, and also I would add also relational losses as well. Some people consider this a trauma, but others, try to distinguish between what traumatic events, and stick to the maybe the clinical DSM-5 kind of terminology for it. But also relational losses or life losses as well with time. So I'm just going to mention something about, I'm going to focus a little bit on the culture because I think that's where my expertise or my experience at least has been, working with families from so many cultures as I spent the last 20 years working with World Relief. So we had different groups, some of them from Eastern Europe, some of them from Africa, the Middle East. And I also did some work here with, Western kind of couple situations. So the relationship between cultures and psychology or psychopathology, quite interesting. Even the term norms, which is and versus normal. So I think for you as psychologists, counselors, mental health clinicians, you always think through this lens. You have a problem with someone or a challenge or a deficit, and then you have this standard of normalcy. Okay, and how can we shift or help or empower someone to go from where he or she is at to where we want, or where we think that is normal and healthy and functional. And our definition of what's normal in many ways has to do with the norms. So what we look at, or even people who established the DSM and thought from a psychopathology perspective, they look to a certain population, a big number of population, and when they found out that the majority of the population act in a certain way, and that was the norm, then they decided that this is what's normal. And then people who are outside the norm, either extremely in positive territory, like they exceed what's normal, or lack then they're out of the norm and we need to work with them some way or another. So, but sometimes when it comes to norms, a lot of these norms are based on cultural perspective. So the norms in certain cultures might not be the same norms in another culture. And one of the issues that we're looking at today is marriage, which is in many ways, it's a cultural phenomenon. Since we don't have time, there are many definitions for culture. The best, in my opinion, is culture is, or any subculture is a group solution for current problems. So, for example, any group of people who live together, it can be 20 or it can be thousands or millions, they live in one area. And because they live together in close proximity, they started having some kind of problems. And to solve the problems, they need to come up with solutions. So different group of people came up with different solutions for the same problem. So marriage actually is one of, it's not a problem, it's a challenge. It's it can be a problem, but it's a challenge. So the different groups around the world, they decided that the best way to go around marriage is to do it this way, right? So the Western world decided that marriage is the best way to go around marriage is doing this way. People, two individuals love each other. Maybe they need to focus on picking up the right partner based on personality, similarities, common interests. Other cultures, they might not perceive it that way. So now comes to us as, and all of us maybe here in this, my understanding that a lot of you practice marital therapy, do some works with couples and families and that kind of stuff. The foundations of the marital therapy as a practice in many ways is based on cultural norms that actually function well in Western culture. So, I mean, psychology in general, it's I mean, if you think of it, it's really a Western science, right? I mean, it started in Vienna from all countries, and it's among the elitist. People go to a room talking to, a professional and that kind of thing. So a lot of that, and things have been moving, I think, toward more including other cultures, but I don't think that we are still there. So, so let me show you two slides here. I think they might shed some idea about talking about normal now versus on the norms, like how, and I think that's what our work is. We're trying to get people to become normal or be functional according to the norms of the specific culture that they live at. So look at these pictures. I put a pictures with Amy, functional Amy, in a Western world. If you're thinking of someone who's really functioning well, doesn't need any mental health help or counseling or something like that, you're looking for those traits, right? Or those skills: independence, being able to live on her own, meeting all her needs, making competence. She's able to multitask, maybe do more than one thing, go to school, get into a career. Individualism, I can talk for days on this notion. That's but basically being able to write her own story by herself instead of living according to the other scripts from certain from her families or from religious institution and that kind of thing. Equality, whether it's gender or status, and being assertive, identifying her needs, asking for her needs, being upfront there, being direct. So that's pretty much what makes Amy functional. And we were starting working with her as an individual or within the couple. We'd like to see some of these, traits or some of these like skills clear. Now, in other culture, I worked with many cultures like that. I mentioned the name Abdullah here, functional. What the norms there in this culture is, what makes Abdullah maybe functional is being collaborative, being able to function within the tribe or the group or the family, someone who puts his family in front of his own personal needs, hierarchy, there are certain structure within the family, within the tribe, even status wise, duties. It doesn't matter how Abdullah feels at the moment. There's certain duties that he has to actually accomplish so that the best interests of the groups are always, are always kept and valued. Hospitality, being open to others, to strangers. And I think some of this you can see it in all cultures, but I think the difference between the different cultures is how much they value this. Okay, so in terms of like each culture values certain values. So there is ranking of how important this value is extremely important for that culture. And I'll give you an example, medical example in a second, but let me, before I jump to the ranking of the values, just touch into the dignity kind of piece here, because I think dignity, and I think a lot of people listen to this like, yeah, of course we have dignity in the Western world, and that's true. But the dignity, in a sense, it is in the Western world, there is a different kind of like a similar or not similar, but it's equivalent to it. It's self-esteem. It's called self-esteem. It doesn't matter really how people or how the tribe or how your group or how your family value you. I mean, these are still important, but the most important thing that kids are taught since a young age in a culture, in the Western culture, is self-esteem. The most important thing, how you look at yourself. Now, in other cultures, that's still important, but it's more important how the group are looking to you. So this is the concept of dignity. Am I respected in the family, or in terms of with my in-laws, or in terms of within the church or the mosque or that kind of stuff? So these are two different. If you are sitting treatment plan, and you're trying to you have goals. The goals are to promote certain skills, or the goals also to increase the awareness of the couple. And youth therapy goals, of course, is you have objectives, how you're gonna accomplish these goals. So you're gonna work on certain things each session. But then the ultimate product of the therapy, if you think of yourself like factories or a company that produce units there, the ultimate product for you from a Western perspective is to produce people like Amy. In other cultures, maybe the ultimate product is to produce someone like Abdullah, who is more collaborative, believe in hierarchies, do his duties, hospitalities, dignities, and that kind of stuff. So, and again, I think that's just something to look at and into it, especially when we work with couples who come from different cultures or subcultures. The ranking of the values might differ according to the culture that you live in. And I'm just gonna focus on this because I think that's a really important point from my experience working with many cultural groups and couples. Let's take, for example, a value. I'm talking about the ranking of the values in each culture. So let's talk about, for example, honesty. All cultures in the world believe honesty is a good thing. It's a value, right? Lying is a bad thing. I mean, there's no other, I don't believe that there will be a culture to say like lying to other people is a good thing. However, the importance of honesty is, especially in terms of relationships, might be ranked differently in terms of importance between different cultures. So in the Western world, honesty, if I ask you, I mean, if I was with you in person, I would actually do this exercise, and I will tell you, like, as a family therapist or a couple therapist, please come up with certain values that you think that the couple should have all the time. I bet on my family's farm that honesty would be on the top 3, because most of you grew up in a place where you're thinking if you don't have honesty, you can't have a relationship, right? So, however, in some cultures, there are other important values that actually might compete with honesty, such as saving the relationship or preserving the relationship. So if you are in a situation between choosing to tell the truth or save the relationship, in some cultures, they might choose to save the relationship over telling the truth. And all of us do this thing to a certain degree, but I think some cultures are more in terms of how much they practice, the intensity and the frequency of how much practice that. And it might look very dysfunctional to us as a therapist. So when I say like all of us practice this, you know, I'm married. I'll give you an example. I think if there's men in the group here, they can relate to this thing. So I wake up in the morning, you know, my wife comes to me and say, "Ta-da! How do you think of my dress?" Okay, and let's assume for the sake of it that is, you know, the dress was really actually looks awful on her, right? So here I'm having two competing values. Should I tell the truth and sleep on the couch for 2 nights, or should I say, you know, well, I look good or something like that, or change the topic or something? It's just to reserve the relationship. So we all cultures we do these things, but I think in certain cultures there's sometimes they value more saving the relationship over the honesty, and sometimes that can be in certain settings very can be misinterpreted because we look through it from a cultural lens. One other thing, so and keep moving forward because we get, believe it or not, 20 minutes done already. Sometimes also, so in terms of this like the values, the norms might, how healthy marriage might look actually very different in different culture. And I think that's where our part comes as therapists to actually ask more questions about like how would your marriage actually in your culture, what would be the ultimate situation between you? How much in terms of communication, resolving conflict, even in living situations, like some people might prefer to live in with their in-laws or something like that, and that's could be really from our from a cultural lens, kind of like, you know, the couple is not doing well, they're not acting well. So the other thing is also is I'm going to mention one piece here, and I don't have time to go through all of these things, but I'm going to talk about the skills, because I think in terms of couple therapy or family therapy, we do typically two things most of the time in terms of your therapeutic goals. You raise in awareness and insight among couples about their like individual issues that are affecting the relationships, and that you might go back and talk about traumatic experiences or relational losses in the past that affect their interaction in the present. And that's one way to improve their relationship. The other thing is to teach them new skills, right? So how to, for example, to communicate better. I think if you if I look to any of your files working with couples or with families, I bet that's one of the goals there, of the objectives, is improving the communications between the couple, right? So even with that, in terms of skills as well, you know, communication might look different. Healthy communication might look different in different cultures. And I think sometimes we just come up with certain skills that they don't really make any sense for couples from different cultures. They just, you know, they might, again, because saving face is really important in this culture, they might not say anything, and they might even pretend that they're doing what they're supposed to do, but they're not doing it. So I'm dividing this into two groups, just to give you an idea how these things, even the cultures, even impact our skills teaching exercises in couple therapy. So the 1/3 world culture, you know, and 2/3 world culture, and I'm using this terminology because I think in many ways we in the West sometimes use you know, condescending terminology when we say like third world country. The third world countries actually make 2/3 of the world. So I think that sounds more accurate in terms of when we address certain culture and that kind of thing. Like how direct versus indirect in terms of communication is huge in certain cultures. The Western world, because it values time very much, that I don't know, no one in this call really complain that he or she has too much time by the end of the day. We wish, all of us, that we have 36 hours during the day. So, and therefore we like to any communication to be direct, because there's no time for us to actually to tell a story to solve a conflict, right? In other parts of the world, they tend to use a lot of indirect communications, maybe parables, stories, and I can mention tons of stories from my experience in working with couples about this. That is sometimes we need also to learn to get into the world of the cultures that we work with, and if they favor parables and stories, I think that makes a lot of sense to get directly to their hearts rather than focusing on teaching them to be like direct. And in many cultures, it might sound blunt and rude to do certain things. So they tend to go indirectly, just because saving face is a value that actually really embraced a lot in most of these cultures. The other thing is in terms of verbal versus paraverbal, and you heard about these things, but sometimes, some exercises sometimes we do is, and I think we do that with marital therapy. We do a lot of or even cognitive behavioral therapy, when you teach clients to rate their reactions to certain things. So for example, if you want to help them to rate their anger level, you actually use certain verbs like I am upset, I am frustrated, and then it goes more to I am angry, I am mad. And the issue with verbal, though, it might not work very well with a lot of cultures, just because English in general has more verbs than any other language. So I speak Arabic, we have one verb for anger. So, while it's in English, we have there's, I think, 23 verbs. I'm annoyed, I'm upset, I'm angry, I'm mad. And then, so people tend to, when I worked with some Iraqi refugees, I think there were incidents where people were called the police for them just because the words, the choice of words that they use. I remember once they called the police for an Iraqi client who said, I'm a ticking bomb. He wanted to say, I'm really, really, really angry. But there's one word in Arabic. So people tend to use more paraverbal communication with this thing. So you need really to be aware of certain parables, stories in the same cultures, or ask them to tell you about these things. I don't know if I have more time to discuss these things. Sometimes one issue is right versus wrong in the West, where it's shame versus honor. So sometimes you can have a situation where it is the right thing to do this, but it's also the shameful thing to do this. And in these cultures, honors will always prevail over right versus wrong. Linear logic versus circular logic, and I'm going to stop here because that's on a different topic, is the way you present your arguments in the Western culture is based on linear logic, which basically you go A plus B equals C, C plus D equal E, therefore the answer is E. So you build, so here I'm presenting for you using a linear logic. I started talking about norms versus normal. And then I talked about functional AV, functional. I'm taking you step by step to reach the point and the ultimate goal to say, we need to think about marital therapy in a different lens when we work with different cultures, because the makeup of their personality is different, the ranking of the values are different, the skills even, how healthy communication look different. So I'm using a linear logic. When I wrote my doctoral dissertation, Dr. Schultz left NIU at that time. I had a hard time with the professors because they kept telling me, they're having like red markers all the time on this thing. You're repeating the same point again and again. But I grew up in a situation where they're actually, they focus on circular logic, which basically you hit the same point again and again and again. And I think I heard so many times, I do supervision sessions sometimes with people who are engaged in like cross-cultural counseling, and they say like the person tends to repeat the same story again. So basically that's the circular logic. You get into one important point and you try to hit it with different stories just to make sure that the person is actually getting the idea. So that's something that I think, even in terms of skills, what do we do? What role plays we do with the couples and individuals and families? It also has to be within the cultural norms. One thing I just want to mention quickly here is when I go back to functional Abdullah, there's the point of a hierarchy, and I think that might be some controversial topic here when we talked in the setting of in the notion within the notion of marriage is the Western notion of marriage is what they call egalitarian marriage. You've got two individuals, they have equal rights, equal say, decisions are made mutually and all of that. And then in many cross-cultural settings, and I think things has been changing lately, but still there seems to be some hierarchy there between still the husband and wife, where the wife has actually a lot of say in all the decisions, but there is the appearance that the man is making the decision, and that's important. So there is some kind of like agreement between both of them, especially in public, where So the question is, and sometimes no, the case is the man believes that he's the one who's going to make the decision. The wife might agree or disagree, so that's a different story. But I'm thinking if you are getting into a cultural situation where you're working with a couple, you have to go from the angle of the cultural piece, because your role is not to change cultural norms. That's not a therapeutic goal. It should never be a therapeutic goal. Now, there is an exceptions when there is abuse, there is with domestic violence, there is something that somebody's getting hurt, control, whatever it is. But in terms of cultural norms, I think, and I think this is slippery slope sometimes for us. And I think we get quickly the idea that, we have to get involved with this thing. And I found from my experience, this always counterproductive. So I remember a story when I worked with a Congolese couple from Africa, and they bickered all the time. There was a lot of issues with them and that kind of stuff. So I used to visit them on a weekly basis. That's when I worked with World Relief. So one time I made a phone call, and the wife picked up the phone, right? So I set up a time. It wasn't the same day. I said, "Here, I'm going to be in this town today. Can I just stop by? I know this is the last minute thing. I just, thought to call." And she said, "Yeah, okay." So I go to their house, and then I saw the man fixing the car outside in the driveway. And then I said, "Hi." He said, "Hi." He was a little bit distant. I didn't know. I thought maybe they're having an argument or something like that. So. And then I went inside. I thought he's going to follow me, that kind of thing. So I was sitting with his wife, 5 minutes, 10 minutes, and I'm thinking, he's not coming. So I went outside to talk to him. And then he said, "You made the appointment with the wife, you meet with the wife." And I had to apologize for that. And the wife did not ask me to do this. It just, and it slipped it's sometimes you do all these mistakes, of course, in cultural settings. But I think if you have any chance to get into really want to help a couple or a family, you can't start with, enforcing the cultural norms of yours, again, unless if there's certain situation of abuse or domestic violence or something like that. But like, if the question has to be first to the husband or a man in certain cultures, so let it be. Maybe with time, you can bring up your own norms. Like here in the country and the West, we actually start either way. That should be a different conversation. And he might not be, or she might not be even comfortable with that. But anyway, so that's the cultural piece. I have 5 more minutes and I like to stop talking because I feel like I talked all the time. And I'm just going to mention quickly about the trauma piece. So in addition to the cultural norms and the acculturation struggles that each couples or family, they have to adjust to in terms of moving to a new culture, learning new norms, and learning how to thrive in this country. There is also usually there's a trauma piece there, and I think that's extremely important. I think if I'm going to mention like a few tips, you always should ask about trauma when you work with couples or families who actually relocate. The lesson that I learned the most when working with refugee groups at World Relief, that after many years, I discovered that most women who I worked with have been raped. And it took me like 10 or 12 years to figure this out. And they acted in they were sometimes like very functional. It seems when you ask them some question, they don't come up with this thing. But after establishing a relationship, every single time I ask about this, they actually were more willing to talk about that than what I thought. And that's applied for men and women. So in certain settings, I think you need to assume that you need just come up with make a space in your mind at some points after you building a good rapport with the family to ask about these questions. Now, in case of the women, they were not, if you are from a different gender, you can always, refer her to the similar gender. And sometimes that's the case. Sometimes it's the other way around. They actually prefer to speak with men. But address this issue. Like at some points, I think it's important that you can ask about these questions. That's from my experience with World Relief. But in general, the traumatic piece, I think how it affects the family, it's the piece of intergenerational trauma. And I think a lot of parents who escaped or have been harassed or even or betrayed or even disappointed with their native country, they kind of like unintentionally send this message that is common among all traumatized people, that is the world that we live in is unsafe place. So they tend to be more overprotective regarding their children. They tend to, have harder time to trust people and to trust their intentions. And nobody should blame them for that. I think once you're betrayed by every single person in your life in the past, it's, there are a lot of questions. Why would you be a different person? So, but I think this the intergenerational trauma that it's kind of like passed to, and sometimes unintentionally to their kids, how is like, we can't trust this world. And sometimes it is like, you can't make sure of the intentions of people, what people, why they're inviting you and that kind of thing. Sometimes it even sounds or feels like it's a paranoia to it. And then they easily jump into this conspiracy theories, like somebody is, the caseworker did not pay for the rent, and it must be that they took the money. And that could be really, difficult to work with, but also disappointing, because you feel like a little bit few sense like, and you've been working together for a while now. You don't trust me with this? But again, I think that's we always need to look at it as a symptoms of trauma or intergenerational trauma that these parents pass. They have and also pass to their children. Okay, I'm gonna stop talking now. But I wanted to bring up 3 pieces there, and I think I jumped from one topic to another, and I don't know how much I was connected with that, but I just want to open up the conversation and see your thoughts on this. I'm sure that some of you also had some experiences working in cross-cultural settings. So I would like to hear if they have similar experiences to mine as well. So feel free to please jump into the microphone and talk. I'll be listening to you.
I had a question. Oops, sorry.
No, you go.
Oh.
Go ahead.
Okay. My question was regarding your views on differentiation and counseling couples or families to differentiate within their family units. As you were speaking, I was thinking about how perhaps this could be a form of white supremacy, since white culture or European culture and North American culture is very focused on being an individual within a relationship and having separate desires and separate goals for ourselves within the context of other relationships. And I was thinking your thoughts on that. Do you perceive that approach as a therapist and as a clinician, encouraging couples and family members to differentiate from one another, a form of bias perhaps, or we're imposing a cultural view on them? What are your thoughts on that?
Well, if I understand your question, I think I've been trained somehow to think this way. I mean, there is a lot of like all people of culture, they have some ethnocentric tendency where they think that my culture is the best norm. Like, you know, this is like, because people are trained to this. This is what's normal look like. So even take, for example, looking at someone when they speak, okay? I have hard time, even someone who's actually been exposed to their Western culture coming here to the States, looking into people eye to eye for quite a while. Because I think it's in the Western culture, it means honesty. You know, kids, like if you drop the eye, it means like you're hiding something. But in some cultures, it means that, you know, you don't need to have, it could be like challenging an authority when you look eye to eye. So I'm talking to a professor or to an immigration officer. I'm just trying to disconnect my eye, you know, the connection with the eye. So I think one of, for example, of the objective goals in many books when we train to be therapists is building a rapport with the clients. And then how you measure that the building the rapport, the client is maintaining eye contact with me. And I think that's a cultural indicator. That's not, I mean, in a Western setting, yes, it is. They're not looking around, they're looking to me, there seems like consistent attention and that kind of thing. But that's in some cultures. Now, all of you guys are looking at me when I'm talking. That's a sign of respect, because you are raised in a cultural norm that tells you that's how you respect someone who's speaking. But if I'm doing the same seminar with a bunch of Saudi women, I can bet that none of them would be actually looking at me eye to eye at this point. People look, and then because there is a different value there, it's the gender separation that takes it's more has a higher ranking than you know, on a, like a connection or displaying respect and that kind of stuff. So I think we need to we need to assess all of these things and see, is this something that this is my ethnocentricity, that is this, or this is something actually, because building a rapport might look different in different culture. It might look, if I'm visiting an Iraqi couple, that they're actually yelling at me for why I am knocking on the door before I came to the house. Like, why? You're a stranger now, you're looking at the door, you just come in, sit down and eat food. That's for them building a rapport, right? So it looks different, or sitting down on the floor and or playing with their kids outside. That's how the good indicators of measuring rapport from the lack of rapport.
I'm intrigued by your question, Dr. Smeir, around your comment about the number of women who have experienced sexual trauma, and if you're working with a family, working with a couple, and you are suspecting the experience of sexual trauma on the part of like the woman was victimized during her refugee status. To speak about that, is that the indirect, is that the direct offense of Western culture, wanting to inquire about what happened? Does that bring harm to the dignity of the marriage if an outsider, an outside male, a Caucasian outside male from a Western culture asks the wife who is potentially a victim of sexual trauma, would she be violating the integrity of her marriage by speaking about that?
I think that's a wonderful question. The issue is, though, it's even more complicated than that, Dr. Sells, because it is many women who have been separated from their husband and families. And most of the time, that's the common actually, is that the children and mothers and children come few years before their husband can join. And it happens all the time. So actually, in many situations, women who have been raped in refugee camps hide this information from their husband. Because this is fearing divorce, fearing that it's a culture that's based on shame versus honor. And that can be the most shameful thing for the husband. A lot of women, they don't really know how can they share this information with their husband. And they live with the secret. And then, so in many ways, if I talked with them, it's going to be very indirectly, not in front of their husbands. They might come to the office, or if I'm going there, he's not there, I mention something. And I would say something kind of very indirectly that, I know from my experience, there's a lot of bad things happen sometimes in refugee camps. And if there's something that's bothering you and you don't want to share it, when I meet with you and husband, feel free to share it with me individually, or also you can talk to my colleague here. If that's make you more comfortable. And I was always amazed by the people who actually wanted to open up and talk to someone else. So I did it in an indirect way, not in front of the husband, but I also, you need to have, I think, a lot of supervision, and I think also you need to see some signs, like and some signs like the red flags that usually typically happen when there's like sexual trauma, where sometimes the husband might complain that the woman is not sexually active with him and that kind of thing. So you always kind of have in your mind, maybe there's something like that there, because they trigger their traumas and that kind of stuff. So yeah, you address it like directly and indirect way. And leave the level of for her space for her to come up and share if she wants to. But again, it's not like this is my experience of what works. It doesn't mean that this is this is the answer. But I think this is a too important topic just to be avoided to talk about, especially if it's impacting the marital relationship between a husband and wife.
Yeah.
Yeah, I have a question, Dr. Smeir. Often whenever doing supervision with students, and lots of people in counseling and psychology are quite Western, quite educated, egalitarianism is an internalized value trait. And then they have their first case of someone who has a different cultural worldview. And this is some of the most difficult kind of steps to traverse. Like, everyone gets a sense that they need to do this, but I wondered if you have worked in supervision with others or consulted with others when people are seeing kind of their first case, and this is the first time they're experiencing this. You shared some good things, but I wonder if you had any more that you could share a little bit more about what people could do to educate, that sort of thing.
I think there is these moments, I think in cross-cultural settings, and I'm sure that some of you guys experience that, there's a certain time when things don't make sense. So you're sitting with someone and you feel this, the look on their face, like kind of like they know that you either lost them or they said something that for you, just like, what? Like in your head saying like, what was that all about? So I think these actually, intuitively, these are actually very important moments in therapy. And I think you always need to ask questions from other people, or even from, if you have a good relationship with the couple or the client, to ask like, you know, what's going on right now? What's so for example, some ideas when you present it for a couple in cross-cultural setting, they don't make any sense of whatsoever. So, and you can see it in their face. So for example, let's think about something that's very common in within the marital modality, boundaries, right? How important is boundaries into the whole modality setting? I mean, it's one of the major foundation there, like, I versus us and that kind of thing, and marriage. So boundaries, in many ways, there is no word for it in many languages. So the word, when you actually translate it on other languages, it really sounds a little bit off. So the boundaries, like in Arabic, for example, it's really a word used for the boundaries of the countries. So when you put it in relational issues, the people's like, what? Like they kind of hit them. So first thing, don't assume that in a certain concept is relevant to what they're saying. However, there are actually ways where actually you can introduce your idea. So the idea is, okay, especially if the couple's like living here in the States, you don't want to keep them isolated culturally, but you want them to thrive in the culture. So you don't want them to stay where they are, but this also, you don't want them to be assimilate and they reject their native culture. There's a way where they can integrate this between keeping good things in this culture, adopting new things in the new culture and that kind of stuff. So for boundaries, if you want to present any new ideas, it's how you present it. So, and this is, I think it's important, that's the oral, the story format. So if you can, and instead of like explaining these things or doing exercises, you've got to use certain stories from your own life, from other people's life, from whatever, just to make the concept actually relevant to what the idea is. Or they can be the issue themselves, but sometimes we come up with certain kind of like mold-made interventions. We're gonna do this thing, fire back.
Thank you.
And there was silence.
Yeah. What is your suggestion in working with men, Arabic men?
Oh boy. You worked with one of them, Dr. Sos, for a while. That was not a pleasant experience for you, was it, as a student?
Yeah, really. Oh, it's delightful. I continue to work with him.
Okay. I think men is, I don't know if I can answer. I don't know if I know how to answer these questions, but I think always, I think you need to, what's the word, I think in from the medical world, is joining them into this thing, join them into the in the therapy process. And I think that's extremely important, and that's applied not to Arabic men too, but it also apply to other men from community-oriented cultures where there is kind of like certain roles within the marriage. So for example, the man go and work and bring the money. He's the one who provide for the money. He might work like so many hours. The woman is, for example, in charge of education. So there is like a set up roles within the marital relationship that's they actually, you're in charge of this, I'm in charge of that kind of thing. So we had several situations when some kids were acting out here in schools and that kind of thing. And then the man was accusing the woman because that's her job. Like, you know, you failed in this and that kind of stuff. So it's hard, first thing, not to take things personal, I think. And you're thinking, yeah, you're the father too. I mean, you're as important, if not more important as well. So so the idea is how we can join him. So sometimes we asked him to get into, it was hard time for them to accept to go into therapy because they thought that this is the wife problem, not my problem. So the one issue. The other issue is if he was willing to go to school and talk to the teachers and that kind of thing. So what you have to do this thing is how to reframe it in a different way. And when I used to do this thing and bring it to the shame and honor, what is the honorable thing to do here? So as a father, as a husband, you know, and I bring it like you're the father. You think you see yourself at the head of the household. You like the honorable thing for you now is to attend this meeting because it's for the keeping the honor of the family. So this is the concept of honor and shame. I think worked very well, but it is how to reframe the conversation. So any topic you want to present it has to be reframed somehow. But I just want to stop here and say, like, we expect them as well after living in a certain culture that also they need to kind of like integrate some of the Western cultures. So like, for example, time, respect people's time, right? So that's there's a lot of like emphasis on the Western notion. People are going to be fired if they don't come on time. So they can't like still also living as if in Africa. They need to. So there's a way where also you need to challenge certain things, but at the same time, I think you know, until you gain their trust, I mean, I think they open up and they're willing to learn a lot of few things. It's all only comes to the idea that you're honorable man. I'm here not to compete with you. I'm here just to be a brother or you know or a father figure and stuff like that. I'm here. I'm working for the best interest of the family. I think that's usually you know a winning strategy.
Very good. Thank you. Well, we're grateful for your participation. And if Isaam, if you could put in the chat box your email address so that anybody that wishes to follow up with you with any other questions, and we are thankful for all who've attended. This is our last Charis Scholar Community Forum for this year, and we are working on our plan, our agenda for next fall, probably with once a month meetings like this, where we invite people from the profession to come and speak and deliver insight into their expertise. So we're very grateful and look forward to more conversation with you directly and then indirectly as time proceeds. Jen, did I miss anything?
No, that's wonderful. Thank you so much, Dr. Smeir. We really appreciate your wisdom.
Yeah.
You're welcome. Invite me again.
Okay.
Yes, good
You'll do
idea.
it. All right. Bye, everybody.
All right.
Bye. Have
Thank
a
you.
good day.
You too.